And we're live. Well, hello, everybody. I want to welcome you to another episode of ChiroSecure's live events. ChiroSecure's live events educate and support you, the practitioner, by making sure you have the information you need to protect you, your practice, and your future. Today we have a very special guest, Dr. Ken Murkowski. He's going to talk about 25 ways to live. If you don't know Dr. Murkowski, he's a leading expert in chiropractic billing and coding. He's the foremost leader in chiropractic forensics. He's an expert witness for both the plaintiffs and the defendants. He's authored over 400 articles and 20 books, and he teaches about compliance, diagnosis, documentation, malpractice prevention, and whiplash-associated disorders. So we're really happy to have him on the show today. He's going to be bringing a lot of valuable content. But before we get started, I want to turn the screen over to Dr. Stu Hoffman, who, with ChiroSecure, is responsible for these great live events. Dr. Hoffman?
Thanks, Alan. I just want to welcome everybody to this show. The last show, we had no idea how enormous of an attraction it would be to our readers. So I'm thankful that we're able to get more and more information out that will be helpful to you in safeguarding yourself, your practice, your family, but also in terms of creating a greater awareness about what you're doing, not from a fear base, but from a service attitude. And that's what we've always worked off of. So Dr. Ken, known from the day I got my first license. He was the president of the Michigan Chiropractic Council at that time, and I've had nothing but enormous respect for how hard of a worker he is and how knowledgeable he is. But remember, today's discussion has a lot of information that he's going to offer up to you. Please do not get overwhelmed with it. This is just information to help you grow your practice. If there's anything needing further explanation, certainly type it in for Alan, and he will get that across to Dr. Ken as we go through this. And, you know, remember, from ChiroSecure's point of view, we want to offer up information. We understand that not everybody agrees with the people that we put on. They don't all agree with me. Take the information, understand that this is for your use and for you to get something positive and reflective from it. And that's really all we're here to do, is offer you that opportunity, and I hope that it's a successful one for you. So again, welcome to our live show. Here's Dr. Ken.
Good afternoon, and I want to say it's a real honor and a privilege to be here today and to share as much information that I possibly can. So I eagerly await your questions from my presentation, and hopefully I can give you some more insights into how the practice of chiropractic is today legally. I always explain to people that basically I'll never ever affect your philosophy or your type of adjusting or even where you get your scientific background. All I'm going to do is go over some of the new legal things that we all have to deal with as practitioners. And as Dr. Hoffman said earlier, so many people have fear of the unknown, and I guess my definition of fear is it's just false evidence appearing real. With information, knowledge is power, and having good knowledge and good information really is going to be to your benefit and that of your staff, and of course the service to your patients for the future.
Well, fantastic, Dr. Ken. Let me jump in here. I want to remind everybody that, number one, on the right-hand side of the page that you're looking at, if you have not already entered your name and contact information to get a copy of the notes, the transcripts, and the replay of this event, do that when you have an opportunity. And one other thing, if you stay to the end of the event, we're going to show you a way that you're going to be able to get every future episode transcript and notes without actually having to worry about fitting it into your schedule. There's just been such an overwhelming amount of people coming to these. We want to make it as easy as possible for you. I will show you that at the end. And then, of course, if you are a ChiroSecure client already, you're automatically going to start receiving these. So one of the things that Dr. Ken and I spoke about preparing for the show, that he gave me such great information, I want to address these first, Dr. Ken, if you don't mind. You had mentioned to me that when we spoke the first time that you said acute sprain strain is what's considered a non-defensible diagnosis. Can you elaborate on that, please?
Sure. You know, years ago, we used to have what we call the 4 Ps of chiropractic, which were palpate, pop, pay, and pray. Of course, under today's rules and regulations, those are gone, and now it's document, document, document. And an acute sprain or sprain is basically a very difficult diagnosis to defense for a chiropractor because it's called common domain diagnostic terminology. And what that means to everyone is that basically any MD, DO, any physical therapist, any claims adjuster can make comment on that diagnosis, so it's because it's such a common diagnostic term. And basically also a lot of doctors forget that when you make that sprain or strain diagnosis, it has 3 portions. It's called mild, moderate, or severe. So if you look up how those words are interpreted legally, mild means it's self-limiting. You don't touch the patient. It'd be contraindicated. If you wrote down this word severe in your file, again, legally speaking, that means all strands are torn. That would be that's going to be a referral for possible surgical intervention. So using sprain or strain, of course, you're going to have to use it as a moderate sprain or strain. Then you're going to grade them 1, 2, 3, or 4, and that has to be a total part of your complete diagnosis. And you want to link, of course, all your diagnoses today to any CPT codes you do. And that's one of the major things that we have to, get across today, is that sprain or strain should never be your primary diagnosis because it's common domain. It should be part of a more comprehensive, precise diagnosis chiropractically.
Okay, so that brings up my second question is, so how about using vertebral subluxation as your diagnosis? And if we should use that or can use that, what do we need to know to be able to defend that diagnosis?
Well, vertebral subluxation complex today is probably the best diagnosis. And the reason I say that is multifaceted. Number one, the first thing that every chiropractor has to understand is that the federal law overseeing chiropractic today deals with a subluxation complex. That is the federal law that's used for Medicare, and of course there's the federal monies now for the new exchange programs. Every state law, and I mean I teach just about, I've been blessed to teach almost every state convention at least once, and every state law has the word subluxation into it for at least all the ones that I've taught in. So if you're talking about subluxation, it's what I call the law of the land, not only on a federal basis but a state basis. Now if you take a step back and look at that again, chiropractic today is reimbursed by doing a 98940, a 98941, or a 98942. That broken down means that you're going to have to take a specific region. You're going to have to specifically put the levels of subluxation in, and that's one of the requirements, for example, again, for Medicare and your documentation with PART, which is the basic gold standard for documentation. And then you have to paint a picture. That's what I call it, painting a picture with diagnostic codes. And how you paint a picture is with your ICD codes. So if you look at the definition of vertebral subluxation that the ACA and ICA agreed to years ago in Carmel, California, there are 8 physical components and 8 chemical components, which means there are 16 possible components for your diagnosis. And of course, sprain, strain, moderate grade, 1, 2, 3, 4 could be part of the physical components. But more importantly, there's an ICD code for each of these 16 components. And the more ICD codes you have in the patient's file, the more you can paint a picture of that patient for the third party, or for Medicare, or for Medicaid, or for a work comp patient, because everybody just paints by numbers. The numbers you give are the only thing the third party carrier knows about the patient. They don't have the luxury of seeing them and touching them and examining them like you do, so you have to paint the picture with numbers.
Okay, and before I want to give them one bonus of value before we really jump into the meat of this, Dr. Ken, because we spoke about this also, and this comes up a lot with practitioners.
Can I ask Dr. Ken a question first?
Sure, go right ahead, jump right in.
One of the things that I was taught from Dr. Murkowski, as well as others years ago, when he's talking about vertebral subluxation diagnosis, and a lot of people are very inclined and happy to utilize that because it fits with a lot of our fellow chiropractors' philosophical stance, as well as a valid diagnostic code. But when we talk about vertebral subluxation, one of the things that he may have elaborated on a little differently in the past was that it's not just that simple, vertebral subluxation of C1 and you're going to get paid. There's actually different components that make up the vertebral subluxation complex, and that's something that I wonder if you can just touch on with the limited time that we have available for us and all of this information today, Dr. Ken.
Oh, absolutely. It's and I hope I made that clear previously when I was speaking. Like I said, there are 8 physical components and 8 chemical. Let's just look at the 8 physical components of subluxation. Of course, there's the osseous component, which is the bone, the connective tissue component, which is the muscles and ligaments and fascia, the disc component, the nerve component, the neurological component, then the altered biomechanical, then of course there's the lymphatic and circulatory, and then the last of course would be visceral. So I guess if we looked at it from a philosophical point of view for our philosophical guests, we would say from above down, inside out. If we looked at it from what the patient would tell you in the office, they would tell you something like, I can't turn my head, I have pain in my neck, it radiates down my arm, my fingers swell up, and they turn blue after I'm done bowling. Well, if you take that statement and then you apply it to those 8 components I just gave you, those would be the part of the 8 physical components. Each one of those components has an ICD code, and again, that would be part of the painting by numbers, as I alluded to, on how you can give the carriers or the Medicare people more insight as to the severity. In other words, if the patient lost their normal lordotic curve, that would be an altered biomechanical problem. If there would be a degenerative disc disease, that would be part of the disc problem and disc diagnosis. If there was a problem, let's say, with the brachial plexus radiating down the arm, you're talking about the nerve component. So all those 8 components that I just gave you then can be honed and go into more detail for a better paint-by-number picture with the ICD codes.
Thanks, Ken. And that was exactly what I wanted to get at, is to give people an illustration. Certainly, this is not a billing and coding seminar, but at the same time, at least people can get a feel for what they would want to start to look toward when they're assessing their patient. Thanks, Alan.
Yeah, sure. Did you want to, Dr. Ken, go into the chemical aspects, or right now you want to leave it where it is?
I think what we do just for this first webinar is let's just keep it, what I call keep it simple, and that's just let's completely concentrate on the physical components of subluxation. And I think once the audience gets it a little clearer understanding on how we can use those 8 physical components to our advantage for not only a diagnosis, but then how you document your care for them, and then we have what we call diagnostic links. In other words, for every CPT code you're going to bill, you have to have it linked with some ICD code. So if you're going to, let's say, do, for example, intersegmental traction on a patient, or if you're going to offer some ice or heat to a patient, or if you're going to offer electric stim to a patient, that has to be linked to your ICD codes, and those codes are linked to the components that you find in your physical exam and your diagnosis. So I think we'll just keep it simple today and leave it on the physical ones, and I can elaborate on those more and the chemical ones at a future date.
Yeah, that's perfect. And I just want to remind everyone that Dr. Ken will be back on the show numerous times. He has a lot of great information he's going to bring. I wanted to, as I started saying before, talk about just for a couple of minutes the Groupon issue, because we get a lot of questions about people that use Groupon or are thinking of using Groupon, and then after we go through that, we'll jump into some of the things that we have on our schedule.
Okay. Groupon or some of the other aspects like social living, obviously in today's society, everyone is tuned in to obviously electronic marketing, electronic communication, blogs, Twitters, everything. Unfortunately, some of these things also have to be scrutinized from a different aspect. And right now, there's what they call the anti-kickback law, which you might have heard of it prior to this as the Stark Law, which has an offshoot which is called the Safe Harbor Law. These are all federal laws, and that law happens to be 42 USC 1320A-7B, and that has to do with getting remuneration for a patient or giving money to obtain a patient. And that, again, is a problem if the federal government, that would be what the federal government calls a violation of the inducement law. So if a Medicare patient or some other federally funded patient comes in and they were induced to come to your office because you were offering like some free exam or free x-ray or something of that nature, that could be construed by many, again, on this federal law called a violation of the federal inducement law. And I don't ever want to have any chiropractor jeopardize anything they have because there's a question on that. So what I suggest is that you check with your personal legal counsel in your state in regards to the interpretation of the federal inducement law, which I gave you again, 42 USC 1320A-7B, and look at it as the Stark Law, the Safe Harbor Law, and address it strictly to Groupon and social living.
And one of the things to add to that, because Ken's right on, I've sent a number of doctors to their own state licensing board to simply ask if they've taken a position on advertising through media such as Groupon. And one of the other points that Dr. Murkowski is talking about is there is a difference when you're paying a flat fee for a Groupon type ad versus paying them a portion of the proceeds that come in from the examination, right, Dr. Ken?
Yes, yes. And I always try to elaborate at my seminars that there is nothing wrong with giving a product to a patient that meets the federal rules and regulations as opposed to a clinical procedure. And again, just for clarification, let's say some doctor wanted to, say, offer free consultations. There's nothing wrong with a free consultation because there is basically no doctor-patient relationship. If you're going to have a doctor-patient relationship to offer free clinical services to get somebody into an office, I caution you on that. But remember, you can still give a patient a product. And I have like a little checklist for products. Number one, it has to be a good, durable DME. Number two, it has to address the patient's condition. Number three, they have to use it daily. Number four, it should help their condition. And number five, they should think of me, the doctor, who gave it to them. So there are a few good products out there that meet that 5 criteria. And I would suggest everyone just think of my example, think of a patient with a bad lateral cervical x-ray. There's no good lateral cervical curve anymore, especially if they're an older patient like Medicare. Cervical pillow or something like that might be an appropriate product, but again, you're not giving them procedures but products.
Okay, terrific. Okay, so Dr. Ken, let's now take a look at some of the ways to lower risk. We've already given some great ones, so that's been terrific. But I have a list here, and I'm going to start at the top of the list, see how many we can cover, and then whatever we don't cover, of course, the next time we have you on the show, we'll continue. And I want to remind everyone again that you're going to get an actual transcript of everything Dr. Ken says. So the first thing we had on the list was 8 types of patients. Do we want to jump into that first?
Absolutely. I mean, everyone wants new patients in the office, but what you have to concept today, because there's just so many types of patients coming into your office, that there are rules and regs for a particular type of patient. For example, I'm going to go through the 8 very quickly, and then I'll try to give you a highlight on each one. The first type of patient would be a general health patient. That's the type of patient that may come to your office and have an insurance for general health care. They could come in and wish to pay cash. They may be interested in a wellness program, or they may want to come to you for some type of rehabilitation. The second type of patient would be an auto patient. Now, obviously, every state is different, whether you're a no-fault state or a fault state. But auto accident patients, there are some rules and regs about how you take care of them and what you should do for them, because that's called the standards of care and the standards of practice. And again, standards of practice is, again, one of the things we always have to consider, especially to prevent malpractice. The third type of patient would be a personal injury patient. Some people think personal injury is automatically an auto or work comp. It's not. It is a personal injury. That is a person that's injured at maybe they fell because their foot got caught in a hole in a rug at their Pilates studio, or they were carrying water softener salt in a produce aisle at the grocery store. And those would be premise liability cases. So it's personal injury. Work comp, of course, every state has specific work comp guidelines. And again, I caution everyone, if you're going to have a work complication, get your state rules and regs in your particular state, okay, on the work comp. The next type of patient, of course, is Medicare. Medicare is very, very specific with rules and regulations. For example, you have to have, every Medicare patient now has to have a treatment plan. And there has been many, many audits. As a matter of fact, in multiple states, California, Texas, Florida, New York, New Jersey, they've already done chiropractic audits, and the federal government has already collected $1 billion in audits just from chiropractors, because many chiropractors, according to the Office of Inspector General, do not document properly. They don't have a treatment plan. And if your treatment plan, for example, is to reduce pain, that would flunk a Medicare audit. There's about 12 things you want to have in your treatment plan to prevent a Medicare audit. Then, of course, you're required to use PART, P-A-R-T, which is pain, asymmetry, range of motion, and tissue on your daily documentation. And on every visit, either the A or the R's got to be included. So again, please review your Medicare guidelines. The next type of patient would be Medicaid, which is a state program. Some states cover it currently. Some will be covering it more, because under the new Obama law in 2014, we have a section called 2706, which is the non-discriminatory section of the new federal law. So a lot of states are now being revisited because Medicaid programs are partially federally funded. One thing I would like to mention in the Medicaid is that there's some offshoots. There's what they call county assistant. We all pay county taxes, and that money goes into a pool. And for those doctors that have patients coming in that may be abused or may have to seek a shelter temporarily, if they need health care, chiropractic, of course, is eligible for that with county assistant funds. Then there's what they call general assistance, and general assistance are for those patients that their health coverage is paid with city tax money, and they go to special shelters also. So this is a great time to be a chiropractor. There's so many more opportunities now because of all this funding, and then of course because of the new federal law section 2706. The next type of patient is an athlete, and athletes can be categorized either to a general athlete, a weekend warrior, but so many now have college athletes or pro athletes, and though again there's some special things you want to take into consideration for treating an athlete, especially a pro athlete whose livelihood depends on their recovery. And then, of course, the patient that needs rehab. So again, all those different types: general health, auto, PI, work comp, Medicare, Medicaid, the patient that is an athlete, or the one that rehabs. That's the 8 types right there. And we should always remember all those types of patients need chiropractic, but again, you have to know what are the rules and regs for your state comp or your no-fault act or things of that nature.
Well, terrific. The second thing, we might have covered this already, was under the heading of... Okay, Stu, you want to jump in?
I want to make a comment that, Dr. Ken, when you talk about greater opportunity now because of all the funding that's available, I understand that. And when I was teaching a seminar, some of the doctors that were sitting in it, they said, well, that's like Obamacare. Everyone's talking about how much more opportunity there is, this, that, and the other thing, but I don't see it in my own office. Well, in terms of the funding, we understand it's there, but at the same time, it has to be implemented to include us as providers and to be paid on par. that's a separate conversation and more of a political one that we need our political leaders to get involved in to help fight the fight so that we can be paid better like other providers in the healthcare marketplace are attempting to do as well, because everybody knows there's increased funding available, but we all need to get a fair piece of that pie. And I think that people need to understand that I don't think you're saying, although you'll correct me if I'm wrong, that, hey, we have greater opportunity, but that doesn't mean every chiropractor in every office in every state is going to instantly see all kinds of new patients, and therefore their income is going to double just because of this.
No, you are totally correct, Dr. Hoffman. I mean, when the exchanges came out, and in my seminars I have a synopsis of what every state now has under the new exchange for chiropractic. Some states have no limits on care, for example, under the exchange program, for example, like New York or Kansas. And then some states have gone to a monetary portion, like $600 for chiropractic benefits. So again, I urge all the doctors to check with their state association as to what the new exchanges are in your state. Find out how you can participate in those particular exchanges. Understand that some of your patients maybe have a policy that's 3 or 4 years old already, and there are some grandfathering clauses that may not be up to speed on the current rule changes. So again, it's very important that the doctor and the staff work together as a team to verify all the benefits. Again, it's this whole third-party thing is a whole new venue for many chiropractors today, because again, so many doors have been opened. Now it's a matter of us politically walking through the doors and getting access to the programs, etc.
Okay, so we only have a few minutes left, and as I said, we're going to have Dr. Ken on the show many times. Worst diagnosis, best diagnosis today. Do we have that covered, or we want to go into that?
No, I think we covered. I mean, the worst diagnosis as a primary diagnosis is acute traumatic sprain or strain. Your best shield today, because of the federal laws and the state laws, is a subluxation complex with components. And I gave those 8 components, and just step back and remember that every one of those components has an ICD code, and those codes can also dovetail into other codes. For example, if there's a problem with connective tissue, is the problem, for example, a 728-85, a muscle spasm? Is there a problem with a ligamentous situation, like, or a 728.9? Is there a problem with a brachial plexus? So you can elaborate on the basic 8 physical components and then add more ICD codes based on your consultation with the patient and your exam, and of course all your diagnostic tests like x-rays. They will all add more ICDs. And to me, what I always tell the doctors is my goal is to have every doctor have at least 25 ICD codes in the patient's file, and I call it a diagnostic bank, because now we've already gone to a new CMS 1500 form, and there's 12 slots on the new form, and those 12 slots where the numbers have been replaced with letters now are important, what you put in each slot, just like in the old CMS. And currently, the way I can give our listeners a good way to remember this is under the new CMS form, which went into effect April Fool's Day of this year, April 1st of this year. I thought our government was funny for implementing it on April 1st day. But you have 12 new slots. And so what I suggest is change your letters to numbers just for practice. And remember that slots 1, 4, 7, and 10 would be for the osseous component of the subluxation, and slot number 2 and 5 and 8 and 11 would be for the discs or the nerve components, and then 3, 6, 9, 12 would be for the complicating factors like a reverse cervical curve or something of that nature, or degenerative disc disease. So you have many options now to paint a better picture by numbers with the new CMS form and the ICD codes for a subluxation.
So if I understood you correctly, what you're trying to share with us is that, yes, we can use vertebral subluxation as a diagnosis, and in addition to that, when you start breaking it down into the components and you have enough diagnosis that fits into your patient profile, then you can interchange them and utilize them to work with the insurance carrier in a productive and constructive way in order to get paid fairly, properly, ethically, and legally.
Yes, because you want, like I said, my goal is to make sure the doctors try to paint a picture with diagnostic numbers so the carrier gets a better idea of what that patient is presenting to you in your particular office. And the better picture you can paint with numbers, there's going to be a better harmonious relationship between the patient, you, and then of course the third party, and the third party controls the reimbursement to the patient or you, depending on what position you've taken in your office.
Well, I think what I'm going to do now is, because we're really at the 30-minute mark, what I'm going to do, Dr. Ken, is let you have the last word before Dr. Stu. If there's anything that you want to summarize here, then I'll turn it over to Dr. Stu to see what he wants to add, give everyone a walkthrough of how they can become part of ChiroSecure's concierge service, where we will send you these live events without you having to actually show up on the website. As much as we'd love to see you live, we want to make sure you get everything. So, Dr. Ken, you're up first. Give the listeners a summary of the show and where you'd like us to go with you as we go further along.
Well, again, my goal is to share as much information as possible to, make sure that you are successful and prosper and can attract more patients in the office. And I think chiropractic right now has a great opportunity, because not only of just look at the TVs today, all the different drugs that are being taken off the market, and how chiropractic can help so much with the quality of life and quality of health care through chiropractic. I think the more people understand that a subluxation has multiple components and how those components affect your nervous system and your environment and how you can improve the quality of life for the patient and their children, that opens the door again for unlimited marketing to attract new patients. And that's, again, one of my primary goals when I teach every weekend, is to make sure everyone understands the subluxation is 8 physical components and 8 chemical ones, the ICD codes. We want better pictures with numbers for everyone, so everyone has a better understanding of how primary chiropractic healthcare works today.
Thanks, Ken. What I'd like to share with everybody, first of all, I really have a strong respect and appreciation for Dr. Murkowski, which is why he's on our show. And we're talking about ways to protect yourself, and there's a lot of different components of that in and of itself. What we're talking about mostly on today's show is about how to protect yourself by billing correctly, because we, as your malpractice provider, offer protection for insurance audits. This is how to get paid better, properly, and to be able to defend yourself if and when you have an actual audit. So I think Dr. Murkowski did a terrific job. I'm very appreciative of him. And we're going to have more on this subject and other ways to protect yourself through different means, different people. We're going to have so many other shows coming up, and they're all going to be different. Some will have Dr. Ken back and go over other parts of this overall topic. But we're going to have many things for all of our doctors, because quite frankly, sometimes I'll get doctors calling me up and saying, well, we don't even bill, we're a cash practice. And sometimes that's actually true, but sometimes it's not. And whatever you think, if you're giving your patient some sort of a form, then you are actually still billing. Because if your information is going into an insurance company, it's still one way or another being billed. And those that are truly a cash practice have no bills, patients are not turning anything in, but other than those people, you're always subjected to a possible audit, whether it be from general insurance or, like Dr. Murkowski was talking about Medicare or Medicaid. And that's important. We want to make sure that everybody is protected and growing their practice and making a better living. So I just want to thank Dr. Ken again for participating with us in this series of live events.
Well, that's really terrific. I'm going to take care of some business things here and show our listeners how they can become part of the ChiroSecure concierge service. So first, I want to give a big thank you to Dr. Murkowski. That was fantastic. As I said, he will be back on the show. I also want to thank Dr. Stu for once again coming to the show and helping out. What I'm going to do is I'm going to show you my screen right now, and what you're seeing on the screen right now is actually the website that you are actually watching. And what we do now is we decided to make this as easy as possible for you based on scheduling. If you'll go ahead and click on the link that says Quick Quotes on the right side of this page, which I'm going to do right now for you. You might lose my audio a little bit. And then when you come to this page, you'll see it says Malpractice in Quick Quote right down over here. You're going to click on that. I'm going to take you to that page, and on this page is a form, and for everyone that fills out the Quick Quote form, what's going to happen is you're going to be automatically entered into our ChiroSecure, what we call concierge service. And what that'll mean is going forward, every show that we do, you will automatically get a replay of the show, you'll get the notes, and you'll get the transcripts. Now, you're filling out this form, of course, if you're already a ChiroSecure client, you're automatically entered in, and just give us a little bit of time. There's so many people involved in this, and then ultimately what we want is to make sure everyone gets what they want. When you fill out a Quick Quote, there is no obligation other than to fill it out and get in the concierge service. Some of you new practitioners, so you'll want to get that Quick Quote right away. Some of you might be going into where you have expiration of your policy, so we'll give those priority over everyone else, but make sure you do it exactly the way I said. You simply go from the live page, click on Quick Quotes, and then fill it out. I'm going to bring myself back on screen. You're probably wondering what I look like since I haven't been on the show, because I've been trying to show you everything that we need. So let me bring myself back here. There I am. I'm Dr. Alan Weinstein. On behalf of myself, on behalf of Dr. Ken Murkowski, on behalf of ChiroSecure and Dr. Stu, we appreciate you coming back to another great live event. We'll be back in 2 weeks with another guest. We'll give you plenty of notice. We'd love to see you come live, but remember, if you do fill out the Quick Quote, you're going to get all the information delivered to you. Give us at least a week for today's episode to be delivered to you. We're getting the transcripts done. We're getting all the notes done for you. So give us at least till the end of the week, and everything going forward you will get once you do that. And if you are a ChiroSecure client already, you're automatically going to get it, not to worry. Thanks again. This is Dr. Alan Weinstein for ChiroSecure. We'll look forward to talking with you soon.